You
I have
said?
the two. Yeah. Yes, that's what I'm going to call it. I have the Tuesdays today.
Yeah. I don't know. I just felt off since I got up this morning. I don't know if it was the fog or what.
Yeah, I had a little of that going. And then after my second cup of coffee, I'm good to go.
Oh, coffee. Couldn't do it without it.
I know. Tell me about it.
Well, we're excited for you to share today.
I'm excited to be here for sure. Thank you.
William, I don't know if you caught that. I'm just asking everyone to introduce themselves in the chat. Name, organization, and then if there's a person who impacted you in your life, how they impacted you. I know we only have so many characters in the chat, but feel free to share or not. Welcome everyone for coming today. Oh, good, Julia. For a while there, I was thinking your screen was frozen, but I can see you moving again, so it's good.
I got bumped, so I jumped back in.
Oh, you did? Okay.
Just in case it happens again, I'll come back in.
And I'll do it again. Did everything go okay Sunday? Were you supposed to be and everything? Good. Okay.
Yeah. Yes.
Good, good.
Church is within a church.
Yep. Yep.
For those of you who know churches, you know what I'm talking about. I did not.
Yep, it works well. The sharing of space. Welcome, everyone. I know people are still filtering in, so we just have people sharing your name, organization, and if you want to share a little bit about a person who impacted you in your life, would love to see and learn a little bit more about you. I shared just a little bit about a former boss of mine, and I learned the hard way about what not to do. We're going to give everyone a few more minutes to join us. We got a minute or two. Go ahead and just put your name, organization, and if you want to share about a person who impacted you in your life and how they did that, feel free or not to share. If you're just joining us, we just ask, make sure you introduce yourself and your organization. And if you feel like sharing about somebody who impacted you in your life, how and why, go ahead and do that in the chat section, and we will get started in another minute or two. Hi, Dora. Hi, Annette.
Hi, how are you guys doing?
Pretty good. How are you? We're going to get started in another minute, just waiting for a few others to join us. I know we have a packed agenda today. Excited to share a lot of good, helpful information for this group. If you are just joining us, feel free to introduce yourself, your organization, and tell us about a person who impacted your life and how. Hi, James, welcome.
Hi, Lisa. I don't know if it was James, me. I saw another James.
Well, hi to both, James. How about that?
Great. And hi to other James.
Thank you for both joining us. Well, we will go ahead and get started. And if you are just joining us, I've seen a few others have joined. Feel free to introduce yourself in the chat with your name, organization. If you want to share a little bit about a person who has impacted you or has in your past impacted you, we encourage or welcome you to do so. And if you do not feel like sharing, that is perfectly fine as well. For those of you, maybe this is your first meeting with us, I am Lisa Cruz at the Multicultural Coalition, serving as the executive director of our recently, I would say, anointed 501c3, which became effective last spring. So we have a number of community updates we just wanted to go through with all of you. And as a reminder, if your organization has an update that you want us to share in our e-newsletter, please feel free to do so. You can email admin@ourmci.org. And these are just a few of the things we have taking place. So number one, just want to let you know, in the space of health equity, we have a number of events coming up at New Monk Professionals. So these are health information events. Many do offer vaccinations for COVID as well, but we just wanted to point out these, everyone is welcome to attend. And so we typically have health information, other partners such as Partnership with us on site, 211, United Way, and many shapes and sizes. And we hand out diapers if there are needs like that and other items. So we have one coming up on May 19th, one on June 14th, and then one on July 12th. So that's at New Monk Professionals, coming up in about the next month. I don't know about you, but I personally am experiencing where a number of people in my circle have COVID. So one of the things I always tell people outside of my circle as well, and I know I keep harping on this, but if you are diagnosed with COVID and you're within those 5 days of symptoms, you have an opportunity to call telehealth. It's available in a number of languages. They evaluate you and then are able to prescribe the antiviral medications right to your door. So I just want to make sure that everyone who needs this information has this information. I've been sending it out like crazy to a number of people, like I said, that I have known with COVID. So just want to make sure everybody has this information to share. So you have that opportunity. Then we just have a few other recommendations too, that with COVID vaccinations, everything is being updated like crazy. This presentation will also be posted to our website, but these are just some of the things that have changed in terms of who's getting vaccinated and when. So make sure you can access this presentation on our website. If you ever have any questions, just give us a holler as well. So things continue to change in vaccinations and that space and what people are getting from boosters to their first rounds. So those are some more updates for you. Also just wanted to update all of you, us at the Multicultural Coalition and our partners had the opportunity to go to what they call a gathering for the RISE Network. If you are not familiar with that, the RISE Network is one of our initial funders for us and our culturally based organizations about 1.5 years ago. So we had a gathering last week and it was amazing because we are part of a cohort of 10 communities across the nation. And this is the first time after meeting for a couple of years that we were able to get together in person. Dr. Pam and I facilitated and led a discussion about belonging and what we are doing in our community spaces and our community building and work. And then it just the personal stories. And what was really great about this gathering is people who spoke at the conference, they were part of the RISE Network. So it was people sharing their lived experiences and their stories. Then one of the things we were tasked with at the last workshop of the gathering was we are going to start to roll out 30, 60, 90 days action plans. And what that means is in 30 days, you're gathering a group of people. It's very similar to what we did with community building and vaccinations. Like we're going to gather people around the table about what are the priorities in our area, and then how can we move things along to 90 days, hitting the ground running with action plans. So stay tuned for more in that area as well as we continue to work with our partners in what are the priorities. So that was Win Week about 1.5 weeks ago. We do have a couple of additional special events taking place, in particular this week. Casa Hispana is running on all cylinders right now. They have an open house. You are encouraged to attend. That is this Thursday. Takes place from 4:30 to 6:30, and that will be at 11. So we're excited about Casa Hispana's open house and Ernie and the team for what's going to take place there. And then on Friday, we have the Mexican consulate also going to be at Casa Hispana on Friday, and they are going to have immigration attorneys on site. So please, we encourage you to spread the word about what's taking place on Thursday and Friday. So we're very excited to welcome back the consulate to our area. And if you have additional questions, I don't know, some of you might have met David Ramirez from the Mexican consulate. He also lives in our area. So here is his contact information. You can also find him on Facebook. Like, we're just super excited to have the Mexican consulate back, and David is a great resource for our community as well. So thank you to the Mexican consulate. Now, with that, I'm super excited. If you guys remember, we are going to incorporate lifting up our area, what we like to say, minoritized small businesses in our area. And if you didn't know, since our inception, Multicultural Coalition has been supporting and promoting small businesses that are owned and led by our multicultural community members. And William is one of those members of the community that we wanted to show our support and help promote what he has going on, especially during the summer months. And here's a little fun fact that you guys might not know is that William and I know William, I'm going to say it, we actually went to UWSP together. So we have known each other, dare I say it, like for almost 30 years.
Yes, yes. I had a little bit more hair, Lisa, but I'm still doing good right now.
Thank you, William. Well, we're excited
All
for you
right.
to share about your small
Excellent.
business. Thank you.
Thank you, Lisa. Thank you, everyone, for this opportunity to talk about our business. How much time do I have? Because you know I'm one of those passionate speakers.
You have about 5 minutes.
Okay, I can do that. All right. Again, William Green. I'm the president of Fox City Flix. We specialize in indoor-outdoor projection screen and LED event solutions. We started our company in 2019 in Neenah, and we serve a 15-mile radius in the Fox Valley area. We have limitless options for applications with our LED trailer, which is new. That'll be rolling out this July. You can advertise your company's ads during movie nights, video game competitions, tailgating, and live sporting events. We also have the option to project your image and brand awareness at concerts, marathons, golf outings, as well as church and worship groups. I'd like to share that this is a family-run business, but a community-inspired business. And we really look forward to continuing to serve our community in many capacities, which now I can announce that we're also looking to expand in the Green Bay market this summer. So we will have our presence in Green Bay. We feel that that's important for us to have organic relationships within the areas that we serve. So we'll have technicians in the Green Bay area serving that marketplace, along with our Appleton, Neenah, and surrounding areas. So that's it in a nutshell.
That is awesome. So, you know, William, as you were talking, I was like, oh my gosh, we got to talk more because there's so much opportunity. And then the other thing I wanted to ask, when you talked about the LED screen, what does that mean?
Oh, yes, exciting. So the LED screen is just a large jumbotron. So when you're at like the Packer games and you can see yourself on the big screen, well, we'll have a mobile unit on a trailer, 22-foot trailer that it will raise by hydraulics, and we can show movies. We can show everything from your brand awareness to messaging that you would like to get out. For example, not to sell you, Lisa, in the group. However, you can advertise some of your upcoming COVID vaccinations and things of that nature, major events and activities and things of that caliber. We're working with the health system in Fond du Lac currently, and we're looking at mental health as one of the items that we will be sharing information on the Jumbotron and other areas within the Fond du Lac community.
That's very cool. Very cool. Does anybody have any questions for William? If somebody wants to book an event or talk to you more, what's the best way to get a hold of you, William?
Yes, you can reach us at foxcityflix.com or give us a call at 920-215-1201.
Awesome. Any questions for William? Yeah, we definitely have to talk more. I had about, a handful of ideas go through my head, so it's all great.
Absolutely. Thank you.
Thank you, William. So we are going to go ahead. Thank you again, William. I think we are on to our featured guest presenter as well, Julia Garvey, who is going to speak with us today about what is taking place with health insurance, with the public health emergency unwinding. If you don't know Julia, she is a considerable resource for all of us when it comes to doing our work and figuring out the needs of the community. And she is with Partnership Community Health Center. So Sarah, did you want to say a few words?
I would love to say a few words. Thanks, Lisa. And thank you, William. I too have my mind spinning over ideas. So this is a great idea you had, Lisa, to feature a small business, because we talked about it, William, but I forgot. So it's great time, top of mind. I also do want to just put an overarching message to the group. Last month, we announced that we would have UMOS featured this month as our speaker, and unfortunately, something did come up. So they did send their apologies. However, it is so timely that we are able to invite Julia to join us today. And as Lisa mentioned, the health insurance navigator at Partnership Community Health. And Julia helps enroll in Wisconsin Medicaid programs and the health insurance marketplace. Her approach is a patient consumer focused and is centered on making health insurance understandable to people of all ages, incomes, and literacy levels, which is what makes this timely presentation so valuable. And Julia, how much value the work you do is. She shares her best practices and provides technical assistance to enrollment assisters at 19 community health centers around Wisconsin, and she leads the East Central Regional Enrollment Network and has participated in several state work groups preparing for Medicaid unwinding. So again, timely topic. Julia, we appreciate you so much for stepping in, pitch hitting today and sharing this great knowledge, and we just value you, and we will see UMOS back in September, guys. So they will be back. Julia, it's all yours. Take it away.
Thank you, Sarah. You make it sound like I know what I'm talking about. And the irony is that I did not understand health insurance until like 10 years ago. I was the person who would call the insurance company and say, talk to me like I'm a child, because I don't even know how to ask the question that I have right now. And I completely believe that it is my lack of not having an industry language. I didn't come from the insurance world that makes me good at communicating about health insurance, because I don't talk in jargon or acronyms. And I come from a place of really wanting to educate. Okay, so we're going to talk about the Medicaid unwinding period and what that means for our community, and maybe even for family members or friends that you know. Next slide, please. We're going to cover what is the unwinding period, what do people need to know now, what if people are no longer eligible for their Medicaid, what are their other options? And then really, even though I'm presenting to you, this is a conversation, because you are the most connected people in our community to mobilize and bring messages to the people that you care about. So we're going to do some action planning or action thinking at the end of this. Okay, so what is the Medicaid unwinding period? And unwinding is a very strange word to associate with a health insurance or state benefit. Let's see what that means. Unwinding really is talking about the steps that the state of Wisconsin needs to take to replace the temporary policies that were put in place during the COVID-19 emergency and go back to regular eligibility, enrollment processes, and the way the state manages those benefits. And the state of Wisconsin Department of Health and Human Services goals are to make this routine operation go smoothly and keep all Wisconsinites covered by insurance, whether they remain enrolled in Medicaid or then transition to an employer without a gap in coverage, or get connected to the healthcare.gov website. We often call it health insurance on the marketplace. So what has been happening in the last 3 years is that since March of 2020, when the COVID pandemic was impacted all of us, all Medicaid renewals were suspended and all terminations were suspended. So everybody who got enrolled since March of 2020 has stayed enrolled regardless of whether or not their income has increased, or maybe they've gone back to work. Maybe they were enrolled in a program that would end shortly after, for instance, the pregnancy of a baby, that normally coverage would end shortly after that. Everybody who has been enrolled has stayed enrolled. Plus, they've not been asked to complete a renewal in this whole entire time. So families who are used to doing annual renewals, those have all been suspended. Not only that, the state of Wisconsin, because every 90 days this public health emergency would be extended, they were very wary of proactively messaging to members. So people have gone for years not really understanding that they still have their benefits. There's been very little messaging proactively like that. So what's happening now is with the passing of the Consolidated Appropriations Act back in December, we are now making plans to roll back all those COVID policies that kept everybody continuously eligible. The rules changed as of April 1st. And what that means is we're going to go back to regular rules with the first renewals starting in June. Next slide, please. What I really want you to understand is that Wisconsin has a plan that is specific to Wisconsin, and it may not be the same information that you hear on a national news program or some other outlet. It does not mean that back to that April 1st, everybody has lost their Medicaid. In fact, you will hear on the news, millions of people are going to lose their Medicaid. It's possible that it's likely that a lot of people are going to lose their Medicaid because they don't complete their renewals. But we want you to know that Wisconsin has a plan to unwind these rules over the course of 12 months. So nobody lost coverage on April 1st, and renewals will be beginning in June, and we're going to keep people enrolled until they're required to do that renewal or asked to do that renewal. So no one's losing benefits right now. Again, there's like 1.6 million people enrolled in Medicaid right now. So administratively, to spread that out, they're dividing it like a piece of pie. And every month, 50 to 60,000 households will be asked to complete their renewal. The first ones will be due the end of June, and it will go all the way through May 31st of 2024. So what we're asking people to do right now is to know your renewal date and then wait to act, because renewing too soon may cause you to lose your benefits early. There are a lot of people who are enrolled right now who are technically over income. If they were to complete a renewal right now and show their income information and become no longer eligible for benefits, when they could have stayed enrolled until a future renewal date, they would lose their
It looks like we may have lost Julia. Let's give her a minute to see if she can log back in. Sorry about this, guys. Give us a second here. She might be able to log back on. We were having technical difficulties before we started the meeting today as well. And Julia had assured us if she got kicked off, she'd just keep logging back on. So let's see if I can get a hold of her too.
Hey, I'm back.
Thank you, Julia, for your persistence.
I'm so sorry. I've never had this happen. Okay, we'll pick it up where did you talk amongst yourself while I was gone?
No, because you weren't gone that long, but I just wanted to point out, Julia, where you left off about people doing things too early, because I think that that's really important in terms of following instructions, correct?
Yep, we're gonna see an example of the letters that households are getting.
Okay.
We do know, we expect that 300,000 to 400,000 people in the state will no longer be eligible for Medicaid. They have since gone back to work, their income has increased. And we want to make for sure that we transition those people to the employer-sponsored coverage that they're offered, or that they get connected to healthcare.gov and get savings to pay for their insurance. Many people have turned 65 and are Medicare eligible and maybe didn't enroll in Medicare because they were enrolled in Medicaid. And then for those people who do not qualify for health insurance, like immigrant moms who had babies during that time that were covered under Medicaid, there are federally qualified health centers in the community that can see patients on our sliding fee scale. So there are coverage options. We just want to make for sure we help people through this process. Okay, so who's going to be impacted? Really, it is everyone who's enrolled in a Medicaid program, and there are many more than just BadgerCare Plus. There's senior care and disability programs and Medicare beneficiary programs that help offset the costs of Medicare. All those Medicaid programs will be impacted by this requirement to complete a renewal. This in turn then impacts everyone who's trying to access care at a clinic, a hospital system, a pharmacy. It impacts our communities because we know that access to healthcare creates healthy communities. If mom goes to the pharmacy to pick up a antibiotic for a child with an earache and finds out that her Medicaid has lapsed, that's a problem for all of us. And then as we've been talking to our staff and staff at other agencies, there are a lot of our friends, family, neighbors who are enrolled in Medicaid, or their children are enrolled in Medicaid. So really everyone is impacted, and you all know 10 people who this will be impacted. And because again, you are the best connection to your communities, we want to work together to make for sure that everyone hears this message and understands that a renewal will be due. Our English language learners, I had the great opportunity to go to the Congolese church service on Sunday night, and they announced it at the service that Medicaid renewals were due. I was there in their fellowship time afterwards and was able to talk to families. Those kinds of connections with the people in our community, and it's gonna need to happen more than once. Every time that we're out in the community, having these conversations or making it available that you might need to do your renewal coming up, and let me help you understand when that will be due. And you're all such a vital part of that communication in our community. Next slide, please. So we know that this is going to be a really administratively burdensome time for completing these. First of all, the letters that come out from the state of Wisconsin are not always the most literate. And this is really blurry to me. Is it blurry to you guys, or is it just the way that it's coming across on my screen? Because I'm going to ask you if you can take a look at this letter that I'm displaying to you, and see if you can identify what month this household needs to complete their renewal. And I'm sure you're there. It's February 29th of 2024. And as a reminder, these renewals are happening starting in June all the way through the end of May of next year. So every household is receiving a one-time letter saying your household's renewal date is such. And then 45 days before that, they'll get a pre-filled renewal packet in the mail. But the state of Wisconsin does not communicate in every language that our community members speak in. So unless you've indicated to on your application that you speak English, Hmong, or a handful of other languages that the state of Wisconsin does communicate in, you may receive a letter not only that comes in a language that you don't understand well, but the actual message of this. 3 paragraphs below is a bolded sentence that says, you don't need to take action now. But you may read this and think, ooh, I'm just going to jump on this right now and get her done. And that could result in you losing your benefits early. We also know that a lot of the times that people call to report changes or to apply, they do it over the phone by calling the Medicaid agency's call center. Wait times are going to be atrocious. In our consortium, we're pretty well staffed and we're not as busy as like the Milwaukee area, but we anticipate that wait lines for just making calls are going to be extended. Plus, these are business hours. And if you're working during the day and you don't have time to make this call and sit on hold for an hour plus, that's going to be a barrier for you completing the renewal. Next slide, please. So we're looking to engage you as community champions to not only spread the word, but to possibly assist families to complete these renewals. We have materials that I'm going to be showing you in a moment, but really our messaging right now is BadgerCare Plus, which is the program most people have, or you can say Medicaid, or you can say your state benefits. Anyway, renewals are coming back. And we're going to source you with the materials to support this conversation. It's wonderful to be able to pivot this group that's done so much work around COVID vaccines and education to being able to have something else that you can share when you're out in the community. So what do people need to know now? The most important thing, next slide, please, is that the state of Wisconsin knows how to reach you. If you've moved in the last 3 years and not provided an updated address or contact information, you may not receive that one-time letter or your pre-filled renewal packet in the mail. We also want to make for sure people identify their renewal dates. And there are a variety of ways we can do this. We can create an access.wisconsin.gov account and see that renewal date. We're going to be helping people download a mobile phone app where we can see renewal dates. We can tell people to look for that letter that they should have received. And then the next step is we want people to wait until 45 days before that renewal due date. And a pre-filled renewal packet is going to be the thing that tells you now it's time to take action. So we work with partners at Covering Wisconsin. There are enrollment assister entity in Wisconsin, and they create these wonderful health insurance literacy how-to sheets. So we will have those available for partners to share. Here's things that you can do. You can help people create access accounts. You don't have to be a certified application counselor or a navigator like we are at Partnership to help someone create an access account. You can then use that login information to download the My Access mobile app. And then all this material or the notifications or the ability to take a picture of your pay stub will be at your fingertips. Now, you cannot complete the renewal on the mobile app, but you can complete a renewal by going to the website, even on your phone. It takes a lot of swiping, but we're going to encourage people, and we're going to assist people to do renewals on the website in as much as possible to avoid that long wait time on the phone. But there are times when you just plain need to call because you need to request an interpreter in Swahili or an interpreter in Mandarin. And it's much more effective when you can use that interpretive service. And that's just going to take some extra time. You can help people read the letters that they bring to you or to fax documents that they might need to submit to prove their income. And I'll tell you what, again, people have not had to report changes for 3 years. Imagine all the job changes or the people who moved in and out of a household that have happened in the last 3 years. Cases are going to be messy. They're going to be sending back information that says, do you still work at ABC Shipping? And maybe you didn't work there for 2 years. So there's going to be a lot of information that they think they know about you that's going to need to be clarified. And that pre-filled packet with all the information can actually be used to just cross things out. I stopped working here in January of 2021, and you can add new material. I My son is now 20, he's moved out of the house. I now work at this. That pre-filled packet can be a great way to walk you through this process, and that can get faxed back or brought right into the county agency in the county that you live in. So that pre-filled packet can be helpful too. Next slide, please. We're going to be helping people do a lot of things online because we're getting more efficient and effective online, and really using that mobile app means that people can take pictures of their pay stubs or upload information. I've had a lot of people, a lot of the refugees that I've served here in person in the office, who love having that mobile phone app, because reporting a change and being asked to send in pay stubs is sometimes really burdensome. But if they can get those pay stubs and then take a picture of it and not have to come in and have us fax it, it gives them that ability to tend their business right on their phone. Next slide, please. So what about people who are no longer eligible? And I'm not sure that you know this, that children are covered at a much higher income limit. So there will be a lot of parents who maybe were laid off early in the pandemic and became eligible. Now they've gone back to work and they may be over income. There are options for people. Let's take a look. And who helps identify these options and do this work. So at Partnership Community Health Center, we have both navigators and certified application counselors. We're licensed from the state of Wisconsin to provide free expert assistance. We know these programs, we know how to problem solve and get things done. And we're available now to help people understand their renewal dates, or even if you anticipate knowing that you're going to lose coverage in the future. A lot of people like to take a look at healthcare.gov and get an understanding of what is health insurance going to cost me in October when I complete my renewal and I know I'm no longer eligible. And we can do that work with people at any time. You don't have to wait. A lot of people want to have that in their heads and understand it. It really puts people at ease. Next slide, please. We're going to be looking to see, are you still eligible for Forward Health? Because if you just missed your renewal, but you're still eligible, we can request a back date and get you reconnected. A lot of people will go to their employer insurance and they have 60 days to go back to their employer and request coverage with this loss of Medicaid. We'll be helping a lot of people who don't have insurance offered from a job. Maybe you work multiple part-time jobs, or you work for a small business that doesn't offer insurance. We can look at healthcare.gov, where you get health insurance plans based on your income, because you get savings in the form of a tax credit. And some people even get their out-of-pocket costs reduced. We also know that, of course, during all these times is an opportunity for scammers to be targeting people. So we really encourage anybody who's using a website to look for that .gov designation, to be wary of anybody who says, I will help you for a fee, or you're losing your insurance and you need to pay to get it reinstated. Those are all scams. And if you've got questions about any information that you're seeing, you can ask us at Partnership and we'll help you understand. Next slide. Health insurance from a job goes through kind of an affordability test. There are some people who are offered insurance, small, I don't mean to be picking on small businesses, but if you don't have a large group that you can really negotiate a great price, there have been times when someone's offered health insurance that's actually considered unaffordable by the standard that we know to apply. Also, there are times when businesses offer a significant discount to the employee, but maybe not such a discount to a spouse or dependents. And we can again assess whether or not that is unaffordable for some other members in your family and help them get enrolled in the marketplace instead. Next slide, please. Marketplace again typically has an open enrollment time, but anybody who's losing Medicaid from now until the end of, well, June of next year will have a special enrollment period to come onto the marketplace at any time. So if I was supposed to complete my renewal in June, and I didn't do it, and I lost my Medicaid and I'm over income and I don't realize it until I go to pick up my 90-day supply of meds in August, then I can still come back to healthcare.gov, even though there's been a significant amount of time, and get a plan on the marketplace that will start the first of the next month. So we will make for sure people don't go uninsured through any longer than they need to be. Next slide, please. So here's where we all put our heads together to talk about not only how we can connect people with this message, but to provide feedback to this group and to myself. I'm connected to several state work groups, and when they're hearing from us that people are not understanding their letters, or people are hearing information from a news program that conflicts with what's going on in Minnesota, your feedback to this group and to me helps escalate this at the state level so that we can improve communications. Next slide, please. You as mobilizers know the best time and way to reach your communities. And there are lots of examples that I'm going to show you of materials that we as partnership and as the host of the Regional Enrollment Network are going to be sourcing a lot of materials for you to use in your businesses or as you're doing outreach. We would be happy to share these materials with you. You can share any digital messaging or social media messaging that partnership pushes out, and I can connect you with other sources who are creating great communications around the Medicaid unwinding. Next slide, please. There are how-to sheets that you can keep at hand. So if you are an organization that can keep how to renew your Medicaid laminated next to a computer that you make available to your clients and help them walk through this process, or help them create an access account, help them understand that your renewal date isn't until May of 2024, so don't take any action right now. It's going to be all hands on deck. Our 6 certified application counselors and navigators cannot do this alone. We have 10,000 patients at partnership who are enrolled in Medicaid. I think in the Tri-County area, there's upwards of 90,000 people who are going to be asked to complete renewals. It's really going to be an all hands on deck scenario, and you can help make for sure people don't fall through the cracks. Next slide, please. Okay, so our brilliant Ryan Smith, who many of you have met, has created some materials that we would like to share with the community. We've printed them and we have literally a buffet table here in our office. The 16 by 20 are quite large, so if you've got that kind of real estate, we would be happy to give you a poster, and we even bought the nice Command double-sided stickies because not everybody's got that material on hand. We don't want to rip off your tape with our sign or your paint with our signs. We've got 8.5 by 11 posters or stand-up table signs. Here's an example. Gabby and Ajir came to get materials from us last Friday to bring to this Congolese church event and share resources. They filled up their bags with materials they thought would be helpful, and then I invited myself to come to their party. That's another thing that we can do. We can collaborate on the events that you have coming up to share this messaging. If you wanted me to do a mini version of a presentation to a network of yours or a business partner of yours, I would be happy to do so. Next slide, please. Through the Regional Enrollment Network, there's also a big network of communications. We push things out through agility ads. Trish, you hear Trish on the radio. You can anticipate probably seeing some local media discussions. If anybody's got Spectrum, I don't. I'm so glad, because I'd be horrified to see my own face pop up. But Covering Wisconsin has an ad around Medicaid unwinding that I'm in. So actually, if you've seen that, write something in the chat. I'm curious to know if it's being shared right now. Next slide, please. So through our, the whole state has created regional enrollment networks, and I host the East Central Regional Enrollment Network. It's roughly drawn on the consortium counties. And what it does is it gives us all an opportunity to have a place to hear this information, from myself and from state policy experts. And then we've got some additional topics that we address on each monthly call. There's also a Spanish speaking enrollment network led by Luli, and coming soon will be a Hmong enrollment network. And again, those will be statewide opportunities for anyone in the state who would like to join the Hmong or the Spanish speaking enrollment network or my regional enrollment network. We're going to be meeting monthly for probably these first 6 months of the unwinding so that we can report what's happening on the ground here. And the state of Wisconsin really appreciates getting that kind of feedback loop. Next slide, please. So Gina, I see your comment. Are the printed informational materials available in Hmong, Spanish and English? Not Kinyarwanda or Swahili, unfortunately. If there's a partner who'd be willing to translate some materials, we'd be happy to work with you on that. It's not a language that the state of Wisconsin translates to. I don't think. I can reach out and ask, but that's a great question. So this is a time, maybe, Lisa, we want to pause and see what questions people might have or any ideas people might have on how you can start sharing this messaging with your clients and networks.
And I'll just offer up to this group that one of the first things, once we learned about the changes and had more idea about what you laid out in this presentation, that we quickly pulled together a group of our culturally based organizations to share this information with them. And like Julia said, met with the Congolese this past Sunday. If there are other ideas like that, and then we've integrated a lot of this information and also have the ability to sign people up for My Access at some of our events as well. But certainly looking to this group, we know that you play an important role in getting the information out and making sure that the misinformation isn't out there as well. Do you have questions for Julia?
Julia, this is Paula Morgan.
Hi, Paula.
Hello there. I'm with BadgerCare for the folks on the call that might not know me. My question for you is, do you believe the health systems like BadgerCare, Ascension, Aurora, are they, I know they're aware of this, are they doing a decent job of communicating this to patients as they, either in the primary care setting or in the hospital setting, or would they benefit from having these materials?
I think every health center and pharmacy should be not only sharing this information, but identifying and communicating with their Medicaid patients. Health centers are really invested in this because 95% of our dental patients have Medicaid. About 50% of our medical patients have Medicaid. And we know that impacts our ability to keep the lights on, as well as the community having access to care. I don't know how this is being rolled out in other major health systems or pharmacies. I know that mom and pop pharmacies are probably much more willing to share information and have something posted, but it's been typically really hard to work with CVS and Walgreens and Walmart to ask them to keep our outreach materials on hand.
I'm wondering if you'd be have some electronic samples of these materials that we can distribute to the folks who are like in registration or other areas, or even our enrollment people inside, just to make sure that they are communicating?
Sure, I can share the materials we've created, but also the state of Wisconsin has developed a toolkit, and they will work with you to personalize to, if you've got enrollment assisters who will help on site, that you can put your own contact information on. And covering Wisconsin, the Navigator entity also has some really wonderful materials that can be personalized. I'm going to give you an example of one of the workflows that one of our health centers in Lakeshore Community Health Center is putting in place. They use electronic health records for registration, and they've included 3 additional questions. Are you aware that Medicaid renewals are coming back? Do you know your due date? And do you need help? And with that information right at registration, it doesn't get missed. Everybody has that conversation. And then they're able to run a report and connect the people who request assistance to assisters within their health centers. All providers have the ability to run a Medicaid report through the Forward Health portal. So there will be ways that health centers can identify their Medicaid patients. Putting in place a workflow to make for sure you really connect with people is something that all systems are going to be looking at.
Thank you, Paula, for your questions. Thank you, Julia. Any other questions from the group? And I know I keep bringing this up, Julia, but I think it's so important, that date on people's renewal letters. And have you heard if somebody went in to renew and then impacted their health insurance?
I've heard some stories, and in early days, the call center was not so busy and they were able to call and make outbound calls and say, you've submitted your renewal early. Did you really mean to do that? And in fact, your renewal is not due until a future time. Once they start getting busy with their full flow of redeterminations, they're not going to be able to take the time to do that. And Mitch Berkey's on the call, and I can see, Mitch, you'd probably like to contribute to that.
Excellent presentation, Julia. So in Calumet County, I supervise the Medicaid program. So we right now are doing tons of outreach for members who are doing premature access renewals. We're trying to highly encourage folks not to do so. Right now, even if it gets busy, our policy, at least in East Central, is to mandate 2 outreach contacts before we process an access application or access renewal. The state has told us that they are trying to put pieces in place on the access that will prevent members from doing early access renewals. So we're hopeful that will be in place soon to prevent that, just that oops, that they didn't mean to do it. The other thing to keep in mind is that Medicaid is just one aspect of the programs we administer. So oftentimes a member might be receiving food share or SNAP or childcare benefits, and they attempt to do all the renewal at one time. Again, we're trying to discourage members from always doing early renewals. The other thing I just wanted to put out on the radar that we just got, and Julia, you may not be aware of this, that we just got an email from the state last week, is that members may have had their certifications continued in Forward Health that may not be, that were emergency services. So these are usually undocumented aliens during a period of time where they either had prenatal care and had their pregnancy related and delivery services covered, or that they ended up in an emergency room. We've been continuing those certifications for emergency room care only for this last 3 years. The state is requiring us to send letters to individuals who might have had emergency services in 2020, letting them know they need to do a renewal if they want their services continued. This is going to be very confusing to that population because A, they may not even know they're on Medicaid, and it was an emergency room visit in 2020. They're getting letters over the next 3 months, while by federal law, we have to tell members their coverage is ended and their options to apply. So just an FYI, the one thing that's different about those letters is they're not coming from the state. They will have the East Central logo on the top of them. They're identified. So again, reach out to the call center best, but those letters are going out. My count, just in Calumet alone, I've got 20 and I only have 5% of the East Central calls population. So it's a pretty significant number of generally undocumented aliens that had coverage and are going to be very confused. So just heads up.
And Mitch, thank you for adding all this. And I just want to raise something in front of you, and you and I can contact each other afterwards. I'd like to talk to you about the amount of people on the IC only group who have to renew this month. And that's not a larger conversation for the group, but from the data, it looks like a disproportionately large group of people from Calumet County, and I'd like to run that by you and see if you see that as well.
We do. So,
really, the bottom line from both Mitch and I is that you can help people understand the letters that they receive if they've got them, or if they don't have it physically on them. By creating an access account, you can then go in and view letters, and anyone can help someone do that. to look at letters and understand what they mean. Before we run out of time, I want to say that I've seen opportunities just on this call of ways that we can collaborate. Sarah, your beautiful screen of you in your bus, in years past, we've put information in your bus panels. I don't know what they're called, but they would look fantastic in your bus. And William, you know how fantastic our material will look on your LED screen. It would be wonderful if we could talk about presenting, having some information about Medicaid renewals are coming back on every event that you're going to do this summer.
Thank you, Julia. And I know Gina Phillips also had a question about, would you like help with for them to contact people with education and renewals?
Absolutely. And Gina, I'm sorry, were you with the health department?
Down in Nashville. Yep.
And again, we can source you with materials. And if you need a mini presentation to your staff, yes. And if you are interested in materials, I'm going to send Lisa kind of our shopping list. And let us know what you'd like. You can come to our office, or I can, time depending, come to you. And just make for sure that you find something that fits your space. Not everybody has a 16 by 20 wall space to hang something. So maybe a tabletop would be best for you, or outreach cards. We have that for you.
Okay, that sounds great. I would love to get that stuff. So I'll wait for that information. I'm more than happy to pick it up. I can do that. And potentially I can see if there's any community partners too that where I may be able to post.
That's great. Thank you, Gina.
Yep. Thank you.
Well, thank you, Julia, for presenting today. What can be a very complex and kind of bumpy ride for those, especially if you don't even realize you have Medicaid and then something's coming along like this. So anyone has further questions, they can contact you, Julia, I think is what I saw. Thank you again for sharing with us. If anybody has anything to promote, I know we have a few minutes left at the end here. Anything going on with your organization that you would like to share in the chat or verbally with us, we welcome that sharing of events coming up, sharing of information. Does anybody have anything to share?
I'd like to share that for Esther. We have a solitary confinement cell replica coming to Appleton on Thursday and Friday. It'll be in the St. Joe's parking lot from 10 a.m. to 6 p.m. both days. So you can come and learn about why that is a barbaric practice.
Thank you, Katie.
Could you say again where that's going to be on Thursday from 10 to 6?
At St. Joe's Church in Appleton in the parking lot.
Okay, thank you.
You're welcome.
Katie, if you have any information or like a flyer or anything like we can share with this group too and beyond, please do.
I can. Yeah.
Yeah, send it our way.
Will do.
Excuse me. Anything else from this group that anybody wants to share? I will hang out for a few minutes here, so feel free to take on the last 2 minutes of this meeting for yourself. We have the next meeting promo, and I believe, Amanda, you are on this call as well. So the next meeting is going to be June 13th at noon. It's going to be Zoom only, and Amanda Martinez from Kids Forward will be joining us to share about Kids Forward. She is the Associate of Policy and Engagement, so we look forward to that. If you haven't met Amanda, she's been at a lot of our community building events in the past at least a year, and also part of these calls as well. So we are excited, Amanda, to have you be our featured presenter. If anything else is going on, feel free to hang out with me. I'll just be here online. As always, we thank you for your participation. Thank you again to our presenter, Julia, for today. And if you have any questions or need materials about what was presented, please feel free to email Julia. And if you don't have that information, we can share that with you again too as well. Thank you so much. Have a great week, you guys, and enjoy the sun. Miss Angela Hicks, I saw you on here.
Is
Wait,
still
you're on
here.
mute. There you are.
Hi.
Hi,
I
totally miss you.
I missed you guys too. And I was thinking, okay, maybe I should share, but I wasn't prepared because some family stuff going on. But
yeah.
So we have this coalition project that we're doing with the council, and it's like 3 survey questions. And I was going to send it to you and see if you could